All right, we're going to compare traditional abdominoplasty versus a progressive tension abdominoplasty, or no drain abdominoplasty as a lot of patients call it. And one of the problems with a traditional abdominoplasty is we are literally just pulling the abdomen down straight and we're sewing it at the bottom. And that creates all the space for fluid accumulation, but equally as important is you can see as we put these pins in that it's very, very straight. It's not purposeful. It's pulled down to the bottom. This is opposed to progressive tension abdominoplasty. When we're doing progressive tension, we're closing all this space as we go. So as we pull down, we place this where we want it. We place a pin where we want it. And these are all done with different sutures. And so we place each of these purposefully. So for example, as we're progressing down, hence progressive tension, maybe we want to bring our contour in a little bit here. We want to bring our contour in here. Again, continuing down, you'll see this is not haphazard. Let's say this is where your belly button is and we want shaping. We want to narrow your waistline. We want to contour it. We're going to continue to pull down. Now we've passed the belly button. And what we want to do is make this even wider. Even wider. And so not a perfect example, if we have more pins, but you kind of get the concept of now we're not just going in one direction, we're actually making purpose on what we do. And so finally, when we get to the bottom here, it's exactly what we're looking for. Now, obviously, with this fabric, with this stretching material, this doesn't look the same, but with your natural tissue, you can get a shape, a contour, and instead of a straight pull down. One of the questions I get a lot is, well, how can you do this without a drain? And the reality is, in a traditional abdominoplasty, you've placed a drain to get rid of all this fluid. And what you can see is, look at all this space that fluid can accumulate. It's wide open. Whereas in progressive tension with all these sutures, and we actually do more than this, there's really just nowhere for fluid to go. It's completely closed space. And as a result, we don't have to place drains. One of the things this doesn't demonstrate is, with this fabric, this is all the same pull. But the reality is our tissue isn't. So imagine if I drew a line across here and here. When we're actually pulling down, we are purposefully pulling this down and placing it. However, you can see when we're doing a traditional abdominoplasty, this being the traditional abdominoplasty, if you pull and your pull is just a little bit off, it's not an exact tension, again, because the real abdomen is not the same as this fabric, you're going to end up with a very irregular pattern scar. And this happens. We see these contour irregularities that can occur because you have all this area for tension, it's not locked down in all these spots, and you see an irregular curve. All right, one of the concerns too with a traditional abdominoplasty of progressive tension is, what if you have wound healing issues? Your tissue doesn't heal together well. So let's imagine this black line is the scar, that lower abdominal scar, and let's say they're both doing great, but in both cases, nutritionally, smoking, bad luck, it doesn't heal well. In a traditional abdominoplasty, what happens is if this opens, it retracts all the way back up. There's nothing to hold it. Let's compare that to a progressive tension abdominoplasty. Nothing happens. The tissue just stays in place. So I think not only does this help not to have drains, give you better contouring and so many other benefits, it also takes the tension off the scar, which gives you a better scar. And if you have healing problems, you're going to have less complications, less issues in a progressive tension abdominoplasty.